This is Christina Fino-Caro for COM 111, Section 885, Informative Speech. And this is the audience. Do you have a mind for science? Do you pride yourself on having strong critical thinking skills? If so, then maybe you should consider a career as a certified registered nurse anesthetist. Certified registered nurse anesthetists, or CRNAs, are pioneers in the field of anesthesiology, providing a career essential to our current healthcare system. As a medic in the Army, I know firsthand the important role CRNAs play in modern medicine. I myself am aspiring to be a CRNA in the future. Today I want to educate you on what a CRNA is and what they do. I would also like to discuss why they're important assets to the medical field and show you how you can become a nurse anesthetist. So I bet many of you are asking yourselves, what is a CRNA anyways? Nurse anesthetists are registered nurses who specialize in the administration of anesthesia for medical procedures and surgeries. They work as part of medical teams with doctors, physicians, surgeons, and anesthesiologists to provide anesthesia. It is the CRNA's responsibility to make sure that the patient won't feel any pain or sensation during their procedure. CRNAs work in many different types of settings. They can work in emergency rooms, surgical rooms, pain management departments, labor and delivery rooms. They also can do plastic surgery practices, dental offices, and many others. Nurse anesthetists have many responsibilities, but their main duties include conducting patient assessments, administering anesthesia. They also monitor the treatment of anesthetic and the recovery from anesthetic treatment, and they also manage a patient's postoperative progress. So now that you have a better understanding of what a nurse anesthetist is and what they do, let's talk about why they are important. Nurse anesthetists have been essential to the medical field for many years now. According to the American Association of Nurse Anesthetists, or the AANA, the field of nurse anesthesiology was first introduced in the 1800s. It first became a certified profession in 1959. There was a high mortality rate for patients that were undergoing anesthesia, so doctors and providers had to look to their nurses to provide the necessary care and attention to patients while undergoing anesthetic treatment during surgeries. A report conducted by the Institute of Medicine in 1999 asserts that anesthesia procedures are 50 times safer since the introduction of nurse anesthesiologists. The AANA estimates that CRNAs provide 34 million anesthetics to patients in the U.S. every year. They're also the primary providers of anesthetic treatment in half of all U.S. hospitals. Similarly, they're the only providers of anesthetic treatment in 70% of rural hospitals and inner city clinics. So why would anyone want to become a CRNA? Well, I'm going to tell you why. Being a nurse anesthetist can be a very rewarding career. According to an article, Best Jobs in America, by CNN Money, a career in nurse anesthesiology is ranked 15 in the top 50 jobs in America. It also reports the profession as having a very high rate of personal satisfaction. In addition to self-satisfaction, as a CRNA, you'll have great job security. The U.S. Department of Health and Human Services reports that the field of nurse anesthesiology is expected to grow 23% by 2016. CRNAs are also compensated very well for their specialized skills. Payscale.com reports that nurse anesthetists with only 5 years of experience can make around $140,000 a year. With more experience and depending on your location, a nurse anesthetist can make over $200,000 a year. But like anything worthwhile, becoming a nurse anesthesiologist does not happen overnight. It takes a lot of hard work and dedication. The first step in becoming a CRNA is to complete a Bachelor's of Nursing, or BSN. It's a 4-year undergraduate nursing program. And then after you have your BSN, you'd have to complete a licensing exam called the NCLEX to become a registered nurse. As a registered nurse, you'd have to have at least 1 year of clinical practice in an acute care setting. Acute care settings can be emergency rooms, intensive care units, or burn units, basically anywhere where a registered nurse can develop their critical thinking skills. The next step would be to complete a Master's of Nursing, which is an MSN, that specializes in anesthesiology. After you've completed your MSN, you still have to take an additional licensing exam to become a CRNA. U.S. News Best Grad School ranks the top 10 nursing anesthesiology programs in the United States. Some of those programs include Virginia Commonwealth University, Rush University, University of Pittsburgh, and Baylor College of Medicine. The U.S. Army has the #1 ranked school for nursing anesthesiology. However, this option does require a 5-year active duty service obligation with the Army. So there are many jobs in the medical field that you can choose from, but now you know more specifically what a nurse anesthetist is, and you also know what they do. I've illustrated why they're important assets to the field of medicine, and I've shown you what steps you need in order to become a CRNA. So why not take advantage of those critical thinking skills and join one of the fastest growing fields in the medical world? Like me, you're now better prepared and more informed to make the decision to become a certified registered nurse anesthetist.